Church Health Center Scholar Program is to raise up new physicians, new healthcare providers, new clergy, new people who care about the link between faith and health. Young professionals who will go on in years to come all over this country and be able to continue the mission of the Church Health Center. It's now become a really important part of the work of the Church Health Center. The scholars are intimately involved in all phases of our work. So it matters to us. Without the scholars, we would have a very difficult time taking care of the thousands of people that come to the Church Health Center.
Well, the Church Health Center is one of a kind. It's the largest facility of this sort that works with people and supported by the faith community, where you can come and learn with doctors, nurses, volunteers, medical assistants, dentists, people that work in development on the fundraising arm, people that work in communications for public relations, people that work with children and child life, people that work to teach exercise and movement, wellness education. There's just a realm of possibilities for people here, and Memphis is a really cool city to live in.
Well, I wanted to stay here in Memphis, and I also wanted some kind of opportunity that would give me the most hands-on clinical experience and a lot of knowledge about the behind-the-scenes work that goes on in a medical clinic. So this seemed like the best option for me.
Church Health Center scholars truly are the cream of the crop. If you're going to go to medical school, we have to feel that you're going to get into medical school. We are here to help people achieve their goals, but we want their goals to be realistic. So we're going to look at your GPA, we're going to look at your MCAT scores, but then if you have sort of passed that litmus test, then there's also an element of commitment to the mission. You know, if you just see that coming to work at the Church Health Center is a way to help you get into medical school, I doubt you'll be selected. But if you're here to want to care for the poor, that you understand the link between faith and health, you want to learn more about it. That's why we really have turned this into a bit of an academic experience as well as a work experience. That there are requirements that we place on you to learn about how faith and health are connected. And it will be a fun experience as well.
You know you're in the right spot when you come here every day and you don't feel like you're actually coming to work. And once you're here in Church Health Center, all the clinic assistants, it's like your own fraternity, without all the dues, of course. But
they teach you really well here. I've learned so much. This is like the best shadowing experience that you could possibly ever get.
It's been a great time. It's a great experience. It's a great group of people that I'm happy to know that I'll be spending a year with, and just in getting to know better. And maybe for the future, when we're all physicians or going off and do other things in life, I know I have people to call and talk to and just vent or just to help get through situations.
We've had people go on all over the country, people who practice in Washington State, people who practice in Ohio and Florida. So our scholars really do scan the entire country, and they're out making a difference.
I'm a family medicine resident at Beth Israel Medical Center in New York City. What I learned at the Church Health Center is that oftentimes when people come to see a physician, they not only have a broken body, but a broken spirit. And it's of utmost importance to address the mind-body connection in order to provide quality health care.
There really are a lot of people out there that want to make a difference in the world and really actually want to help people out of the kindness of their hearts, because nobody here makes a lot of money for what they do. No one here is they're not receiving, like I said, a lot of benefits or anything like that for working here. They're doing it purely because they want to help people and they want to go home at the end of the day with a sense of accomplishment and worth.
Church Health Center is popular in the community. It's a good opportunity to come to get some clinical experience, which med schools love. And it's a big resume builder, but on top of that, you feel like the clinic is an asset to the community, but at the same time, you're getting more out of it than you're actually giving, and that's a good part of it.
But we need young people out there believing in the whole link between faith and health, to understand how for a new generation this whole mission is important, and in the future will be even more important.
I just realized this place really does a lot of good work. because they're helping these people get medical care when there's no way they could do it. And even if they could, it would take a huge chunk out of their financial resources.
You will not be the same person you are today after you've been at the Church Health Center for a year. It will make you a different person. You will see the whole sense of calling to medicine in a different way. You'll understand the importance of caring for the poor. You'll understand the link between faith and health in a way you've never understood it before.
Relationships I've formed here, the opportunities I've had, interacting with patients, interacting with managers, seeing the whole way the clinic's put together has been great. It's been absolutely the best choice I could have been doing for the past year.
And so it feels really good to know that I can kind of explain what we're doing and share and say, hey, I do this cool stuff every day, and there are ways that you can get involved too, and you can kind of experience it for yourself.
By being a Church Health Center scholar, you will be a part of a ministry that's bigger than you, that's making a difference in this city and in this world.